A medical assistant receives a stat potassium level result of 6.9 milliequivalent/L. What should be the assistant's immediate action? A. Document and file the result in the chart. B. Notify the provider immediately. C. Schedule the patient for a follow-up. D. Repeat the venipuncture for confirmation. Answer: B. A potassium level above 6.0 milliequivalent/L indicates potential cardiac risk. The provider must be notified immediately as this is a critical, panic, value. While assisting with a sterile dressing change, the medical assistant accidentally touches the sterile field. The correct response is to A. Ignore and continue. B. Replace only the contaminated instrument. C. Stop and set up a new sterile field. D. Cover the area with sterile gauze. Answer: C. Any contamination of a sterile field requires a complete reset to maintain aseptic technique. A patient has a blood pressure of 90/56 mm of mercury and reports dizziness. The assistant should A. Place the patient in a supine position and alert the provider. B. Document as normal. C. Ask the patient to stand for recheck. D. Increase room temperature. Answer: A. Low blood pressure with dizziness indicates hypotension. Lying flat helps maintain cerebral perfusion until evaluated. Which of the following terms describes the heart's ability to generate its own electrical impulses? A. Excitability. B. Contractility. C. Automaticity. D. Conductivity. Answer: C. Automaticity refers to the heart's pacemaker cells, mainly the SA node, generating impulses without external stimuli. Which tube should be drawn first for blood cultures? A. Sterile yellow or culture bottles. B. Blue top. C. Lavender. D. Green top. Answer: A. Blood culture bottles or sterile yellow tops are drawn first to avoid contamination from other additives. A CCMA must explain a procedure to a non-English speaking patient. What is the correct protocol? A. Use a bilingual family member to interpret. B. Provide written instructions in English. C. Use a certified medical interpreter. D. Skip consent and proceed. Answer: C. Only certified medical interpreters ensure legal and accurate communication for informed consent. A patient's EKG shows a consistent P wave before each QRS complex with a rate of 58 BPM. What rhythm is most likely present? A. Atrial fibrillation. B. Sinus bradycardia. C. Junctional rhythm. D. Ventricular tachycardia. Answer: B. A normal sinus rhythm under 60 BPM indicates sinus bradycardia originating from the SA node. Which action violates HIPAA regulations? A. Faxing a lab report to a specialist with a signed release. B. Discussing a patient's diagnosis with another provider involved in care. C. Leaving a voicemail stating test results. D. Using patient initials on public schedules. Answer: C. Leaving identifiable health details on voicemail breaches confidentiality. Only contact information without health data may be left. Which of the following tests requires the use of a chain of custody form? A. Glucose tolerance test. B. Urine culture. C. Drug screening. D. CBC. Answer: C. Chain of custody ensures specimen accountability from collection to analysis for legal drug testing. Which landmark is used to locate the correct site for an intramuscular deltoid injection? A. Greater trochanter. B. Acromion process. C. Iliac crest. D. Olecranon. Answer B. The deltoid injection site is 2 finger widths below the acromion process. A medical assistant must prepare a 5 ml medication dose from a vial labeled 250 mg per 2 ml. How many mg will the patient receive? A. 300 mg. B. 500 mg. C. 625 mg. D. 250 mg. Answer C. 250 mg divided by 2 ml equals 125 mg per milliliter. 125 mg times 5 ml equals 625 mg total dose. When documenting patient care, a correction should be made by A. Erasing the incorrect entry. B. Using whiteout. C. Drawing a single line through the error, initialing, and dating it. D. Deleting the entry. Answer C. Legal corrections in medical documentation require a single line through the error, initials, and date to maintain record integrity. Which of the following additives prevents glycolysis in a glucose test? A. Heparin. B. Sodium fluoride. C. EDTA. D. Citrate. Answer B. Sodium fluoride inhibits glycolysis, preserving glucose levels for accurate testing. A CCMA notes that a patient's hematocrit and hemoglobin values are both critically low. What should the assistant anticipate? A. Thrombocytopenia. B. Leukemia. C. Anemia. D. Polycythemia. Answer C. Low hemoglobin and hematocrit indicate anemia due to reduced red blood cell mass. Which of the following agencies regulates workplace safety for healthcare employees? A. CDC. B. OSHA. C. FDA. D. CLIA. Answer B. OSHA enforces workplace safety standards to prevent exposure to hazards and infectious materials. The correct sequence for removing PPE is A. Gown, mask, gloves. B. Gloves, gown, mask. C. Mask, gloves, gown. D. Gown, gloves, mask. Answer B. Gloves are most contaminated and should be removed first, followed by gown, then mask last. Which position is used for rectal temperature measurement in adults? A. Fowler's. B. Lithotomy. C. Sims. D. Supine. Answer C. Sims position, left lateral, allows safe rectal access and prevents injury. What is the proper angle for a subcutaneous injection? A. 10 to 15 degrees. B. 45 degrees. C. 90 degrees. D. 30 degrees. Answer B. Subcutaneous injections are administered at a 45 degrees angle into fatty tissue. A patient calls reporting severe chest pain radiating to the left arm. The assistant should A. Schedule an appointment for the next day. B. Advise the patient to rest. C. Instruct the patient to call emergency services. D. Transfer the call to billing. Answer C. Chest pain with radiation indicates possible myocardial infarction. Immediate emergency intervention is required. Which EKG artifact appears as evenly spaced spikes caused by electrical interference? A. Wandering baseline. B. Somatic tremor. C. AC interference. D. Interrupted baseline. Answer C. AC interference produces consistent electrical spikes due to nearby electrical devices. What is the proper temperature for storing most vaccines in a medical refrigerator? A. 0 to 2 degrees Celsius. B. 2 to 8 degrees Celsius. C. 10 to 15 degrees Celsius. D. 15 to 20 degrees Celsius. Answer, B. Most vaccines require storage between 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit, to maintain potency. A hemolyzed blood sample appears. A. Clear yellow. B. Milky white. C. Pink or red. D. Greenish. Answer, C. Hemolysis causes RBC rupture, releasing hemoglobin and giving serum a red or pink hue. Which of the following is considered a CLIA-waived test? A. CBC. B. Urinalysis dipstick. C. Arterial blood gas. D. WBC differential. Answer, B. Urinalysis dipstick tests are CLIA waived because they are simple, low risk, and produce quick results. During a venipuncture, if a hematoma forms, the CCMA should A. Continue the draw quickly. B. Release the tourniquet and apply pressure. C. Apply ice and reinsert the needle. D. Massage the area. Answer, B. Immediate pressure stops bleeding. The tourniquet must be released to prevent further injury. A patient scheduled for a fasting blood glucose test drinks coffee with sugar. The CCMA should A. Proceed with the draw. B. Refuse to collect. C. Change it to a random test. D. Note it in the chart and inform the provider. Answer, D. Sugar intake invalidates fasting results. Provider must decide whether to proceed or reschedule. The primary goal of medical asepsis is to A. Eliminate all microorganisms. B. Reduce pathogens to prevent infection. C. Create a sterile field. D. Kill spores and viruses. Answer, B. Medical asepsis reduces microbial load. Surgical asepsis eliminates all microorganisms. The best site for capillary collection in adults is A. Earlobe. B. Great toe. C. Ring or middle finger. D. Index finger. Answer, C. The lateral sides of the ring or middle finger provide good blood flow and reduce injury risk. A CCMA notices an expired reagent strip for urinalysis. The correct action is to A. Use it if stored properly. B. Use and note the expiration. C. Discard and replace it. D. Rinse before using. Answer, C. Expired reagents give unreliable results and must be discarded per safety standards. When assisting with a Pap smear, which instrument collects the cervical sample? A. Curette. B. Cytobrush or spatula. C. Speculum. D. Tenaculum. Answer, B. A cytobrush or spatula is used to collect epithelial cells from the cervix for cytological examination. The 5 rights of medication administration include A. Right patient, drug, dose, route, and time. B. Right chart, drug, date, code, and age. C. Right storage, dose, site, provider, and brand. D. Right provider, insurance, and frequency. Answer, A. These 5 checks prevent medication errors and ensure safe drug administration. A patient's blood sample shows hemolysis after venipuncture. Which action most likely caused this? A. Using a butterfly needle at a shallow angle. B. Allowing the tourniquet to remain for less than 1 minute. C. Shaking the tube vigorously after collection. D. Using the correct tube order of draw. Answer: C. Vigorous shaking destroys red blood cells, leading to hemolysis and inaccurate laboratory results. Tubes should be gently inverted instead. A medical assistant is assigned to perform a pulmonary function test, PFT. Which of the following patient conditions requires physician clearance before testing? A. Mild hypertension. B. Recent myocardial infarction. C. Chronic sinusitis. D. Controlled asthma. Answer: B. A patient who has had a recent heart attack may experience cardiac strain during a PFT, requiring physician clearance first. The correct procedure when calibrating an ECG machine is to ensure the 1 mV signal produces a vertical deflection of A. 5 mm. B. 20 mm. C. 15 mm. D. 10 mm. Answer: D. The ECG machine must produce a 10 mm deflection for every 1 mV signal to ensure accurate recording and interpretation. Which laboratory department would handle a test for thyroid-stimulating hormone, TSH? A. Hematology. B. Immunology. C. Microbiology. D. Cytology. Answer: B. TSH is a hormone assay analyzed in the immunology or endocrinology department, which specializes in hormone and antibody testing. The double-entry bookkeeping system in a medical office means that A. Income is recorded twice. B. Only electronic entries are made. C. Patient statements are duplicated. D. Each transaction has both a debit and credit entry. Answer: D. Double-entry bookkeeping ensures accuracy by recording each transaction in 2 accounts, 1 debit and 1 credit, to balance financial records. When a patient's medical record is requested by another healthcare facility, the medical assistant must first A. Fax the record immediately. B. Obtain the patient's written authorization. C. Notify the insurance company. D. Provide only the billing information. Answer: B. Patient confidentiality laws require written authorization before releasing medical records to protect patient privacy under HIPAA. Which ECG abnormality indicates delayed ventricular repolarization? A. Prolonged QT interval. B. Short PR interval. C. Tall P waves. D. Flattened T waves. Answer: A. A prolonged QT interval indicates delayed ventricular repolarization and may predispose the patient to arrhythmias. The safest method to dispose of a used needle is to A. Recap it carefully before discarding. B. Bend it to prevent reuse. C. Place it directly into a puncture-resistant sharps container. D. Wrap it in gauze before throwing away. Answer: C. Needles must be disposed of in approved sharps containers immediately after use to prevent accidental needle stick injuries. Which term describes the process of converting medical procedures into numerical codes? A. Transcription. B. Coding. C. Auditing. D. Indexing. Answer: B. Coding translates medical services and diagnoses into numerical formats for billing and insurance processing. What is the main function of quality control, QC, in a clinical laboratory? A. To reduce specimen volume. B. To verify the accuracy of test results. C. To speed up testing time. D. To automate billing procedures. Answer: B. QC ensures reliability of laboratory tests by verifying instrument performance and accuracy of analytical procedures. Which of the following is a violation of OSHA's bloodborne pathogen standard? A. Wearing gloves during venipuncture. B. Disposing of waste in biohazard bags. C. Using PPE during specimen handling. D. Eating lunch in a laboratory area. Answer: D. Eating or drinking in a laboratory exposes workers to biological hazards and violates OSHA's bloodborne pathogen regulations. A patient presents with polyuria and weight loss. Which diagnostic test is most appropriate? A. CBC. B. Fasting blood glucose. C. Cholesterol panel. D. Coagulation test. Answer: B. Polyuria and weight loss are classic signs of diabetes. A fasting blood glucose test helps confirm hyperglycemia. During a routine ECG, the medical assistant notices somatic tremors. What should they do? A. Instruct the patient to hold their breath. B. Switch to another lead. C. Replace the electrodes. D. Ensure the patient relaxes and remains still. Answer: D. Somatic tremors are caused by muscle movement. Instructing the patient to relax eliminates interference. When administering a subcutaneous injection, the needle should be inserted at A. 15 degrees. B. 45 degrees. C. 90 degrees. D. 120 degrees. Answer: B. Subcutaneous injections are given at a 45-degree angle to deliver medication into the fatty layer beneath the skin. A physician orders 1.5 g of ceftriaxone IM. The available vial contains 500 mg per milliliter. How many ml should be administered? A. 1 milliliter. B. 2 milliliters. C. 3 milliliters. D. 4 milliliters. Answer: C. 1.5 g equals 1,500 milligrams. 1,500 milligrams divided by 500 milligrams per milliliter equals 3 milliliters required for administration. A patient reports dizziness after venipuncture. What is the medical assistant's immediate action? A. Give the patient water. B. Lower the patient's head and stay with them. C. Call the physician. D. Continue with the next patient. Answer: B. Dizziness may signal syncope. The assistant must lower the head, monitor the patient, and ensure safety before leaving. Which law governs the disclosure of a patient's health information? A. CLIA. B. FDA. C. OSHA. D. HIPAA. Answer: D. HIPAA regulates privacy and security of medical information to prevent unauthorized disclosure. Which electrolyte imbalance can result from excessive vomiting? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypocalcemia. Answer: B. Vomiting causes loss of gastric fluids rich in potassium, leading to hypokalemia and muscle weakness. A physician instructs to give 25 milligrams of a drug, but only 50 milligrams tablets are available. How many tablets should be given? A. 1/2 tablet. B. 1 tablet. C. 1.5 tablets. D. 2 tablets. Answer: A. 25 milligrams divided by 50 milligrams equals 0.5, therefore, half of the 50 milligrams tablet should be given to achieve the correct dose. When measuring blood pressure, which of the following errors will give a falsely high reading? A. Using a cuff that is too large. B. Deflating the cuff too slowly. C. Placing the cuff over clothing. D. Using the correct cuff size. Answer: C. Placing the cuff over clothing increases resistance, leading to inaccurate and falsely elevated readings.